We focus so much on federal policy and needed to be sensitized to the role that state policy played in healthcare delivery. We added state site visits so that we could contrast and compare, let the fellows see firsthand. The notion of all states being alike is certainly not true.
The fellows vote and get to influence the selection of those locations. They try to pick two places that are very different from each other in some way. So it could be based on income of the states, it could be geographical, it could be urban versus rural, something that makes them a contrast. So my group went to Alabama and Rhode Island. And during those trips, we do a series of meetings with state health policymakers, as well as advocacy organizations and other leaders in the area around policy to learn about what it's like to make policy on a state level.
As we're thinking about the places we want to visit, we're trying to figure out, well, what sort of experiences are going to give us insight into how federal health policy is actually enacted at the state level. And it's really interesting because there's so many different ways you could slice it. And the goal is to just get a deeper perspective and understanding of what that looks like.
So we went to Alabama and Rhode Island, divergent states. Alabama is a non-expansion state. So Alabama, if you're a poor man and not disabled, you have no health insurance. It's almost impossible to get health insurance. And the state of Alabama loses a lot of money about that because in the immediate aftermath of the Accountable Care Act, they were matching at 110%. So they were paying states effectively to take this money, and still some states declined. And so Alabama is still in that situation where they haven't expanded. And it was quite an interesting and eye-opening for our group.
It's very illuminating because, for instance, when we were in Alabama's a state that you might not think of as being super progressive in terms of, say, maternal health or mental health care. But speaking to local leaders, we learned that actually they are leading a lot of very progressive work on a local level, which highlights the idea that policy and politics is always local, right? That, on a big picture, maybe there's one attitude or prevailing, feeling about policy, but you can always find individuals and smaller groups of people who are doing important work on topics, which is why I think suspending our beliefs and impressions and going in and learning about people as individuals, learning about the actual work they're trying to do, you can usually find areas of agreement and progress that need to be made.
There were some very devoted people there trying to make sure that everyone who needed it got mental health care services. And so it was very fascinating to find out within a structure that wasn't really supportive of providing people with the care they need. There were some extremely dedicated people trying to make sure that they got that care, people who were too poor to afford it. And then to contrast that with Rhode Island, which has had Democratic supermajorities for decades. Really robust work they're doing. The state of Rhode Island just legislated, put into law the need to have safe consumption sites for people who are using drugs in order to prevent deaths from overdose. And so they're sort of leading the pack on services for people who are in the most desperate need of those services. So it was very interesting to see those two contrasts.
I think it's a really important piece of the program that gives just greater context. And it's that sort of context that I think allows us to be most effective on the Hill.